My favorite thing about the Juvederm line, whether it's those for the lips or Voluma for the cheeks, and their different purposes, is that it's a hyaluronic acid, so it's natural, more natural to the body, and there's an enzyme to dissolve it if there's a problem. So it's very, very user-friendly, and it's much easier for us to feel safe injecting. If it is to their specifications, fabulous, we can try to repeat that. But if it's not just perfect, we can add or subtract with hyaluronic acids, or they can just ride it out to the next time, and now we know what to avoid, unlike surgery or something more permanent. The nice thing about the hyaluronic acids is they're more instant gratification than some of the other products. However, they're still gradual enough that we get subtle changes over time so that it's not an instantaneous, ooh, you had work done. So we can do it much more subtly so that it's more discreet. So people are much happier about that. Obviously versus surgery, something more invasive, there's much less downtime, obviously. And it's much more comfortable, short-term and long-term.
Wrinkles and lines aren't the only signs of aging. With age, the face sags due to natural loss of volume in the cheek area. Juvederm Voluma injectable filler gives you a subtle, youthful lift and contour. Proven to last over 2 years with one treatment, patients reported looking up to 5 years younger. See how effective, easy and affordable Voluma can be. Use code word 50 to gain a $50 credit when scheduling your free Perfection consultation. Perfection Plastic Surgery and Skincare, pursuing perfection in all we do for you.
Specifically for the lips, we have a whole variety, but Juvederm Volbella is the newest one, Ultra, and then Ultra Plus, and all of those come with lidocaine in them, but we pre-numb topically beforehand. They all have different functions, but the Volbella is, at this point, FDA approved for lips, primarily the vertical lip lines, very soft filler. The Ultra is also FDA approved for lips. It's a little bit firmer, gives a little more volumization, as opposed to filling fine lines. And then the Ultra Plus is designed primarily for perioral areas. So we have the nasolabial folds, the marionette lines, and other areas, but we use it for lips too. If we're filling the cheeks, it lasts for up to 2 years. If it lasted longer than that, we age a lot in that time. We also fluctuate in terms of weight. So where we put it might not be ideal over the long term if it were to last any longer than that. So it can be discreet and give us good volumization, etc., but not be permanent where it may not be ideally placed. With people who are on a weight loss track, I personally, especially as a personal trainer, I personally like to say hold off on any fillers unless you have an event coming up. Hold off on any fillers until you say have 5 or 10 more pounds to lose. Use it as a reward for all of your hard work, because also at that point we can put it in a place where it should be, as opposed to doing it initially, they lose weight and now it's not anywhere near to where they needed it. Typically people are thrilled. They like the way it feels and the way it looks, and that it's subtle changes. But we've had even as far as people coming in tears, good tears, way beyond what they expected. Tears of joy because of the confidence that it has built for them.